Okay, so what'd you think?
President did a great job laying out the case for health care. First stating the case about why we need it, how many families are losing their health care every day, how many are without insurance, how many face bankruptcy because of bills. Then dispelling some of the despicable myths that have been put out there about the health care debate and the health care bill. And then talking to us in very clear terms about what would be in a bill, what it would mean, including support for a public option, and why that would bring competition and choice for Americans and help lower the health care costs for all of us. And then I think the last thing he did was have a very strong close, talking about the American character, about what's really good about us as a people, about our generosity and our willingness to look out for each other and take care of each other. And I thought he did a really great job.
Now, I know a lot about Ohio because I'm from Ohio. Doug Kelly, who's head of the executive director of the Ohio Democratic Party, is a very close friend of mine, has his own health care problems, which he's had for a while. And I'll tell you, there's two issues. One is Ohio, and that Ohio is really the center of some of the best health care in the world. And how do you keep that going as an industry in the state? Cleveland Clinic, Ohio University Medical Center, et cetera. And secondly, what do you do with the vast unemployment in Ohio and to try and keep health care?
Right. Well, those great institutions like the Cleveland Clinic, like the Ohio State University Hospital System and the James Cancer Hospital or Columbus Children's Hospital, Nationwide Children's Hospital, are all very important assets to us in Ohio. And I think it's very important to note that most of those institutions, if not all of them, are very supportive of health care reform. Right now they're spending a lot of money taking care of people who have no insurance. And a bill that would, provide reimbursement for the uninsured, for those hospitals, that would adjust some of the things that we need to adjust in Medicare, that would maybe have a healthier population, that wouldn't need to use the emergency room as the doctor of last resort. I think the hospitals see that as a very good thing. But we do need to have more jobs in Ohio, especially when we're very a state that has lost jobs for a number of years now. And I think one of the key things about the health care bill is if small businesses can have their employees insured, can get some help with credits for health care, they can see their costs go down for their health care insurance. They can have the freedom to maybe start a new business because they won't be worried about being left out of the healthcare system. And I think that energy and those extra dollars can help us create more jobs. General Motors last year spent more money on healthcare insurance than they did on steel for their cars. And we know how tied Ohio is to the auto parts industry. So helping us become more competitive as a nation, I think, means addressing this healthcare system, and I think it'll be good for Ohio jobs.
Are you working with some Republicans on that?
On the healthcare bill?
In Ohio.
So far in the House, the Republicans have not shown a particular interest in supporting the healthcare bill, even though I'm not on the committees of jurisdiction, but in those committees, there were Republican amendments that were supported by the committee, voted in by the committee, and yet the Republicans voted against the bill coming out of the committee. So we'd love to have more support from them. I think the constituents in Ohio would love to see more support. I think there are a lot of people in the neighboring districts in central Ohio could use some help with health care, and I think they would like to see their representatives take that on.
Thank you so much.
You're welcome.